My name is Deb Brucker from the University of New Hampshire, and I'm pleased to present the panel on the latest on federal data collection regarding disability statistics. And I am extra pleased that it's a panel full of women today. So I will turn it over to Julie Weeks to begin.
Good morning, everyone. I'm probably the first speaker who is not from the University of New Hampshire today. I'm from the National Center for Health Statistics, and I'm going to present for you today an update on some of the things that I've been talking about in the past couple of years. I'm very lucky to be invited again this year, so this is an update. And I haven't included this slide often, but I did want to orient you to what the National Center for Health Statistics is. It is one of the 13 federal statistical agencies. We have a very decentralized system in the US. And when it comes to official statistics, each one of these agencies has the responsibility of collecting and releasing statistics in their area. And one of the things that is a real advancement for those of us who are interested in disability is that most of these agencies now disaggregate their regular releases of statistical information by disability. So, that's a real big plus. I placed the National Center for Health Statistics at the top here, not because we are at the top, but so that you could find it. We collect data in a number of ways. The two major population-based surveys that I wanted to update you on today are the National Health Interview Survey and the National Health and Nutrition Examination Survey. These are nationally representative. They are collected annually. The NHIS is released annually, and NHIS is released in 2-year cycles. So the 2019 and 2020 data will be released in the fall of 2021. So it takes 2 years. The major difference between those two surveys is that NHIS has an exam component. So in addition to all of the population data that are collected from the respondent in the household, they then have a subset of those respondents come to a mobile exam center and do a number of examinations. So you can get self-reported diabetes, and you can get diagnosis of diabetes, and you can start to look at some of the differences in reporting as well as other kind of exam issues that come up. Both surveys collect information on children. In the NHIS, children are those under 18, and those are all conducted by proxy. In NHIS, also under 18, also primarily collected by proxy, but for 16 and 17-year-olds who are participating in the survey, they self-report. I'll mention, if I have time, a couple of other related activities going on at the center, some special population data collection and development issues, and as well as a Washington group update. So since we last talked last year, I spent a great deal of time at that presentation talking about the changes that are coming to the National Health Interview Survey, its redesign. That redesign is in the field. If you look at the bottom of this slide, the full implementation of the new content went into the field in January. So in this year preceding that, there's a lot of work done to field test the new questionnaire, to train the interviewers, get them very comfortable with the new content and flow. And in the last portion of the year, and I want to call your attention to this next to the last block called Bridge Results. In the last portion of that year, the sample was split so that half of the sample got the old content and half of the sample got the new content. So we have some nice bridge results that will be employed in some of the releases that are happening. Sample adult response rates are up about 5%. The overall interview is coming in under an hour, and there is substantial evidence of less burden on our respondents. And again, these are real issues that I talked about last year in terms of the impetus to really redesign that content and make some hard changes about those cuts. This is, again, to refresh your memory about how the HIS is designed. In this new design, there will no longer be a family component. So the interviewer will go into the household, and they will have a sample adult, or they will have a sample child, and they will interview those individuals directly. Again, this is about 30,000 households a year, so there will be a sample adult in every single one of those households, and in about a third, a sample child will be identified. And during that part of the questionnaire, which is administered annually, you will find the functioning and disability-related variables, the bulk of those. There's a rotating core section of this questionnaire. These are newer topic areas or special topics, or maybe they're expanded detail on topics that happen in the annual section. And those will be rotating sometimes 1 year on, 1 year off, back and forth. Sometimes they're 2 years on, 1 off, 2 on, 1 off. These kind of rotate depending on the periodicity, kind of designed to capture the best information. And then at the bottom of the slide, I mentioned the sponsored supplements. There's always room on the HIS. If you have about 150K, you can buy a question. It doesn't mean put any question on the survey. It doesn't have to go through a bit of an evaluation. But there is content area space for sponsored content on the HIS. Very quickly, here is the functioning content that is on the HIS. On the two bars on the left are the adults, and what you'll see is the major domains of functioning are covered there. The Washington Group short set are the 6 questions in the first column. They're very similar to the ACS 6 questions without the binary response options. There is expanded content, so moving one column over, there are additional questions in some areas like hearing, mobility, and cognition, and there are other additional functional domains where questions will be asked about anxiety, depression, pain, and fatigue, and upper body. Very important for the HIS is this is the first time that they will fully include the child functioning module that was developed jointly between UNICEF and the Washington Group. So this is a very in-depth battery of questions designed for either children 2 to 4 or children 5 to 17. And again, the major domains here are listed, and I want to call your attention to the bottom of those 2 columns because there are things like learning, coping with change, relationships, and controlling behavior, which are very unique domains of functioning for children. There are several areas that are very important to, I know, the research audience here. These questions remain on the HIS in the annual section of the survey. That's the work limitation question, the social activity limitation question on participating in social activities. Participation, you may recall, this is an old IADL question. It's also part of the ACS 6, difficulty doing errands alone. And then there are a great number of mental health measures, the Kessler, the patient health questionnaire, and then there's a generalized anxiety disorder battery for adults, and then there is a behavioral module assessment for children. So that's the HIS. On Haynes, what you see here is a slide that very much looks like the HIS. A couple of differences. Haynes does not collect questions on children under 5. So that one column is missing here. In addition, for children 5 to 17, there are a few less domains of functioning there. Haynes does include those 3 questions that all of us love: work limitation, social activity, and participation limitation, and they do have the additional mental health measures for adults only. A couple of other things that I wanted to mention by way of update. You'll hear a little bit more about some of these. I've already mentioned that children are the big news here in terms of the collection of disability data in these newly designed surveys. NHIS and Haynes will be fully implementing that child functioning module. And so, so much of the time we are talking to the 18 and over population, but we'll really have some data here soon on an annual basis for children in some expanded domain areas of interest. We are updating our population prevalence of IDD. There will be papers coming out this year. There's some work to develop new questions in the area of IDD and identifying that population, and I'll talk a little bit more about that this afternoon, as well as conducting the cognitive testing of those new questions and even some of the existing questions in the Collaborating Center for Questionnaire Design, Evaluation, Research at NCHS. Lastly, I just wanted to mention that the questions that are on these major surveys at NCHS and elsewhere are getting a lot of coverage internationally. If you have graduate students who use either the mixed or the demographic and health surveys, those functioning questions for adults are on those surveys, as well as living standards and measurement study surveys, and all World Bank sponsored data collections are now including the Washington Group questions. The short set of questions have been endorsed by the UN Statistical Division and the Economic Commission for Europe. So those are on the 2020 round of surveys, and about 75 countries have now included and conducted their survey, included the Washington Group, and conducted their surveys thus far. And then just a bit of, at the bottom here, I did want to mention that the real uptake in the use of these questions outside of what we're seeing in the federal statistical system is the use of those questions by other DPOs and NGOs. In some very interesting places, I might add. We've seen them used in refugee camps, in humanitarian situations. Site Savers is using them. IDA has been including them in their data collections. So in terms of being able to really look at the same types of questions and the data they collect across a multitude of sources, the future is looking pretty bright there. I put some links at the end of my presentation for those of you who will be able to access that online for more information about the content, especially of the HIS and the Haynes surveys and all of those ancillary variables that are collected around the functioning variables. You can get those there. Thank you.
Push the green button?
Yep.
Okay, good. My name is Danielle Taylor. I work with the U.S. Census Bureau. This is my second time here, so I am still terrified. It will be fine. I'm going to talk to you today about the data that we produce, as well as kind of give you a highlight of some of the research that we've done related to disability. All right. So the Census Bureau produces a lot of data, and if you were here yesterday, a lot of the surveys that we conduct were used in statistics all over the place. Some of the surveys that we conduct that include disability are the ACS, the SIPP, the AHS, which is the American Housing Survey, as well as the CPS. Also, just to mention it one more time, we did use, in 2014, we conducted a one-time supplement to the SIPP that was sponsored by the SSA. And I'm kind of going over this very quickly because I keep talking over 10 minutes when I time myself. So the American Community Survey has by far the largest sample of all of our surveys. In 2017, we fielded interviews for more than 2 million households and more than 157,000 people that live in group quarters. Group quarters are places like colleges, nursing homes, prisons, jails, that sort of a thing. As a result of this, the ACS produces estimates for a variety of smaller geographies, such as zip codes, block group level, census tracts, and we are used by a lot of local governments for project planning and resource allocation. There are three main products that you get from the ACS, and they a lot of them intersect disability with various socioeconomic characteristics. The one-year file is used for geographies that have a population of at least 65,000 or more, whereas the 5-year file is used to produce estimates for all of the geographies in the U.S., such as all of the counties in the U.S., because some of the counties don't have populations that meet the 65,000 threshold. We also have something called the one-year supplemental tables, which kind of produce a condensed version of the statistics that are available for geographies of at least 20,000 or more. So as many of you are aware, the 6 disability questions used in the ACS are also used in many other federal surveys, including the CPS, the AHS, and the SIPP. On the screen, you have kind of the layout of our paper form. This is how the questions look in our paper form. And just to highlight what we talk on, the 6 questions in the ACS hit hearing disability, seeing disability, cognitive difficulties, mobility difficulties, self-care, and independent living. Also, based on input that the Census Bureau received from the Interagency Council on Statistical Policy, we have formed a subcommittee of federal stakeholders to review the current ACS disability questions. Data products from the ACS can be found on one of 2 places, actually. American Fact Finder is the main dissemination tool. Lots of tables there. Duplicated in that table is a beta tool they're developing at data.census.gov, actual website name. It is live, it is active, it provides the same data as American Fact Finder. If you want to use it, test it, provide feedback. They would like to hear from people who are using this data to find out what they're looking for. All right, these next 2 slides are actually interactive maps that the Census Bureau has developed, similar to what was presented in the first panel. This map is county level, all counties in the U.S., selected features of those counties, one of which is disability. If you highlight over a particular county, it'll show you the statistic for that county. This map focuses at the state level for the population 65 years and older. Similar to the county map, the dots at the bottom break down, in this example, disability by sex. And if you hover over a particular state, you can see disability broken down by 3 selected age groups. All right, it hates me. I pushed the button. So the AHS is a survey a lot of people aren't aware of. It's a household survey in the sense that the sample is a physical house. And they also ask questions about people who live in that house. So what you can get is a variety of housing and household characteristics in conjunction with disability for those people. Also in 2019, the AHS will be fielding kind of an extended version of their home accessibility section. So they're going to ask respondents questions about, do you use a mobility aid to get around inside your home, as well as do you have the ability to access and use certain rooms, like your kitchen or your bathroom or your bedroom. 2017 data for the AHS was released this year, so unfortunately 2019 data will take another year because this one is done every 2 years. The survey of income and program participation is my personal favorite survey in the entire world. It is a longitudinal survey that goes in depth for data users and researchers about a variety of different topics. The SIPP was redesigned starting with the 2014 panel. So now we collect waves once a year, and every panel is 4 years. So if the 2014 panel, because everything was redesigned, our release of waves was slower than we wanted it to be. We've got 2 waves out now, and we finally finalized that processing. So the next waves and all future panels should come out more regularly as expected. Yeah. So disability in the SIPP, as I mentioned, is the 6 basic ACS questions that I covered previously. We also have 3 questions for children disability. There's an under 5 question for children with developmental delays, as well as 2 questions on children asking about difficulty doing schoolwork and difficulty getting along with other children to play. We also have 3 questions about work difficulties, such as difficulty performing a kinder amount of work, difficulty finding or keeping a job, and the inability to do work at all. As I mentioned, in 2014, we did a one-time supplement for the Social Security Administration on the SIPP. And the reason this is so, well, for me, this was my baby. I did this. This was mine. It was 130 different questions on disability related to a variety of topics that I am not going to read, but they are on the screen. And the SSA can be merged back to the 2014 SIPP panel so that you can use these kind of 130 detailed questions in conjunction with the various topics that are collected in the SIPP. Using this feature, we released the Americans with Disabilities 2014 report in November, which gets into disability severity, functional limitations, activities of daily living, health conditions. We have sections in there about psychological symptoms, feeling depressed, anxious, stressed, that sort of a thing, as well as a review of various socioeconomic characteristics of the population with disabilities, like personal earnings and family income, work limitations, and healthcare utilization. I am not getting a time. Okay, we're going to continue going. I had 3 extra slides about this because that report took a lot and I cut them. So please read it, please. The last 2 slides are about research that we have done. This paper was done by Edward Burchick. What he wanted to do was look at the relationship between GED attainment, very specifically, and disability status. And he looked at it at the county level, and what he found in the first half of his paper is that the relationship exists and that it varies depending upon what county a person lives in. So the next half of his paper was trying to explain why this variation exists. He modeled various individual and county level characteristics, and unfortunately none of the ones that he modeled were able to explain why the variation exists. I have the list of characteristics. It did not fit on the slide, but you can also email him to ask him questions. He's going to do continuing research looking at other things to try and explain why that variation does exist. This last paper, Heidi Jackson and I did, and it looked specifically at the disability rate in the SIPP, in the 2014 SIPP panel. So people started reporting higher with the 2014 SIPP panel, and we needed to find out why. So we broke down all of the processing that we do on the SIPP, from data collection to transferring those answers into data sets. We looked at weighting, we looked at editing, we looked at sample composition from the 2014 SIPP to the 2008 SIPP. We compared it to the ACS and the NHIS and other federal surveys to kind of benchmark it. And ultimately, what we came to the conclusion of is that nothing from collection through processing to publication had a noticeable impact on any of this. The high disability prevalence in the 2014 SIPP is a function of how people reported. And to the best of our knowledge, from what we are able to determine, the data is actually good quality. And so this paper kind of exists to explain what we did to determine that. And that is everything I have. There are online links throughout the survey as well as on here, lots of websites if you want to see anything that I have talked about. And that is my contact information at the end. Feel free to give us a call.
Hi, it's a pleasure to be able to report to you today on the data activities of the Disability and Health Branch within the National Center on Birth Defects and Developmental Disabilities. Here's a brief outline of what I hope to cover: the organizational structure of our center, the mission and core principles that we go about doing our work by, the disability and health programs and partners that we have at the local, state, and national levels, our disability and health data system, which provides state-level data on the health of adults with disabilities and those without, as well as some of our other population-based data sources that we use during our work. We have several data activities underway that I would like to share with you, and recent publications and works in progress. And finally, what we have planned for 2019. The National Center on Birth Defects and Developmental Disabilities has 3 divisions: the Division of Blood Disorders, the Division of Congenital and Developmental Disorders, formerly known as the Division of Birth Defects and Developmental Disabilities, and the Division of Human Development and Disability. And the Disability and Health Branch sits within this division. And I am Catherine Okoro. I don't think I introduced myself. I'm an epidemiologist on the Disability Research and EPI team in the Disability and Health Branch. We have fine-tuned our mission to promote the health and full participation in society of people with disabilities across the lifespan. Our work spans all age groups and all 6 functional disability types, but we have a concentrated effort in people with mobility limitations and intellectual disabilities. The pursuit of improved health outcomes for people with disabilities requires our branch to understand the health disparities experienced by people with disabilities across the lifespan, and to address them with effective programmatic efforts with partners at the local, state, and national levels. This is our disability roadmap that illustrates how we go about executing our collective efforts to accomplish this mission. As depicted in this roadmap, the branch works along these 5 core principles to work across public health systems to encourage inclusion and make sure people with disabilities have access to the same public health programs that seek to improve the health of the whole population. We focus on specific functional populations with accommodations as necessary, and we develop and implement public health programs for people with specific limitations and impairments. The next slide depicts our disability roadmap using a multi-level approach. Our branch focuses on implementing a socio-ecological model to implement a social ecological model that is inclusive and concentrates on increasing healthy behaviors, decreasing the prevalence of chronic disease risk factors such as physical inactivity, obesity, and smoking, and increasing the sustainability of programmatic policy, systems, and environmental improvements, such as the availability of effective health promotion programs for people with disabilities. In short, our branch aims to increase social and environmental improvements in infrastructure and services that foster the successful participation of people with disabilities in all areas of life. The next few slides list our national, state, and local partners and programs with whom we collaborate with. The branch funds 19 state disability and health programs who are working to improve health and quality of life among people with disabilities, specifically mobility limitations and/or intellectual and developmental disabilities. We do this through adaptation and implementation of evidence-based strategies in individual communities. The branch also funds 2 national partners on disability, the National Center on Health, Physical Activity, and Disability, or NCPAD, and Special Olympics, who are working to develop, implement, evaluate, and report on activities aimed at reducing health differences between people with and without disabilities. Again, aiming to improve the health of persons with mobility limitations and/or intellectual and developmental disabilities. In addition, shown on this slide are several other disability and health partners that we collaborate with on disability-specific programs and research. One that I would like to highlight is our program partner, the National Association of Chronic Disease Directors. The Disability and Health Branch currently collaborates through funding its partner, the National Association of Chronic Disease Directors, for a project titled Reaching People with Disabilities Through Healthy Communities. Through this project, 5 states and 10 communities in each of the states are working together to design programs and policies specifically to include people with disabilities so they have the same opportunities for physical activity, healthy eating, and social participation as people without disabilities. This slide highlights 3 of our projects for the Reaching People with Disabilities Through Healthy Communities. In Sioux City, Iowa, they have taken a climbing wall and made it inclusive for people with disabilities. In Adams County, Ohio, 2 school districts have collaborated with the National Association of Chronic Disease Directors and special education teachers to ensure that they have an inclusive physical activity policy in place and have provided adapted bicycles throughout their school districts. And then we have in Oregon a mobility device charging stations that have been installed throughout the community, as well as in the Oregon State House, the first in the nation to have this. This slide depicts our disability and health data system. This is an interactive tool presenting state-level data on measures of health for adults with disability. DHDS allows you to identify differences in health among adults with disability and those without disabilities. Currently, DHDS includes 2016 data that have been analyzed from the Behavioral Risk Factor Surveillance System. The main focus is on disability status, any disability versus no disability, and disability type, serious difficulty in hearing, vision, cognition, mobility, and any difficulty in self-care or independent living disabilities. There are over 30 demographic and health measures, including hypertension, obesity, heart disease, diabetes, and 5 health-related health behaviors. We feel that these data are very necessary for local and community-level programming. There are main ways that we like to think about using the data on the DHDS. Data users can view the data on one topic for all states and participating territories. And they can do this through customizable and downloadable data tables, as well as mapping. The second way is through comparison reports, where they can compare the health of adults with disability to the health of adults without disabilities overall, and by location, geography, and by the year of data. We also have state-level profiles available in both PDF and HTML formats. On our DHDS website and also on YouTube, there are instructional videos available, one targeted towards beginning users and one for more advanced users of the system. And we provide examples on how to use these data to plan for disability-inclusive programs and services. For much of our work, we rely on the use of the 6 standard disability questions recommended by HHS and asked in many population-based surveys, such as the Behavioral Risk Factors Surveillance System, the NHIS, and the National Health and Nutrition Examination Survey. We also use other population-based surveys that are not necessarily health-focused, but they do contain information on disabilities, such as the American Community Survey and the Survey of Income and Program Participation. We have a comprehensive list of the surveys that contain the 6 recommended questions from the HHS available on our website. We have also been exploring the use of administrative data sets, such as the Medicaid data, which can allow us to better identify and characterize the health of individuals who have intellectual and developmental disabilities. These individuals may be harder to identify in some of the population-based surveys that I have mentioned. The state Medicaid project has developed over the past few years and has grown from 1 state to now where we currently fund 10 states to utilize the Medicaid data and to identify patterns of health and healthcare utilization among adults with intellectual and developmental disabilities in their states. We are also funding a randomized intervention trial in South Carolina where monthly prompts are about hypertension medication to see whether it improves adherence to blood pressure lowering medication. At the conclusion of this trial, we will conduct an assessment to determine whether the intervention successfully increased medication adherence among adults with IDD. In addition, we have recently funded 2 programs. One will use National Health Interview Survey data and Medical Expenditure Panel Survey data from 2010 to 2016 to examine the factors for opiate use in adults with physical disabilities and those with intellectual and developmental disabilities. We will also look at the prescribing filling behaviors and the healthcare differences in utilization among these adults with these types of disabilities. The second project that we have recently funded is to use national data from the Medical Panel Expenditure Survey and other data sources to examine healthcare expenditures for adults with disabilities. This will be an update of our previously published 2006 estimates. We also have a seat at the CMS Virtual Research Data Center, and we have identified at the state level adults and children with ID, and we plan to use this as an initial start of using these data to examine oral health among adults with ID. During the course of our work, we also utilize other types of data, including the Porter Novelli Styles data. These data are developed with technical guidance from federal health partners and others, and CDC licenses the data that results from these surveys. We have added questions such as hearing difficulty, intellectual disability, physical activity, and emergency preparedness to these surveys. And write-ups of the results are either ongoing or have already been published. In 2017 and 2018, we also added a question to the NHIS to investigate factors that may contribute to cognitive difficulty. So for people who indicated that they have a problem with concentration, remembering or making decisions, they are asked this question: what is the main reason for your difficulty concentrating, remembering, or making decisions? And we look forward to analyzing this data when the 2018 data are available. Here are several recent 2018 publications that have been produced by CDC staff in collaboration with health partners across the country. Two that I would like to highlight are products of our state Medicaid project. One entitled Using Medicaid Data to Characterize Persons with Intellectual and Developmental Disabilities in 5 states in the U.S. And the second, Factors Associated with Ambulatory Care Sensitive Emergency Visits for South Carolina Medicaid members with ID. We have several works in various stages of production, one looking at antihypertensive medication use among adults with IDD, another looking at physical activity types among U.S. adults with mobility disability, and two that our state Medicaid project is well, they're in clearance. That takes a minute at CDC. Looking at utilization of emergency and inpatient care among adults and children with IDD. And later this year, we do plan to have a morbidity and mortality weekly report focused on food insecurity by disability and gender. Upcoming in 2019, we have a meeting that we will be participating with our state Medicaid project collaborators on in South Carolina, and that will occur later this month. And the primary focus of the meeting will be to continue our work on several research projects, as well as the main focus of their last few years of the work plans, which will be the development dissemination, and evaluation of an evidence-based series that looks at diabetes self-management education and support for people with IDD, their caregivers, and their healthcare providers. DHDS will also be updated later this spring to include the 2017 data analyzed from the Behavioral Risk Factor Surveillance System. And we look forward, for the past year, we have been privileged to participate in 2 work groups spearheaded by the Administration on Intellectual and Developmental Disabilities, looking at the future data needs of people with intellectual and developmental disabilities. You will hear more about these work groups and the outputs in today's afternoon session. And finally, I'd like to thank you all for your time and attention today. In the online version of this slide set, I have all the links and references available for your use. Thank you.
Very nice. It came up, I didn't have to do anything. All right, happy early Valentine's Day, everybody. I'm saying that just to see if you're sleeping. So I'm Savi Swick. I'm from the Office of Disability Employment Policy. And I have been coming here for the last couple of years and talking about this survey that ODEP would be doing. And this year, Andrew said, don't talk about it anymore. Give us some results. So we found, I brought some preliminary results of this survey to share with you today. So how do I move this? Okay. So here's an overview of this presentation. I will give you the background of this study, tell you about the methodology, describe the characteristics of employers that we surveyed, share some preliminary results and other analysis planned to be done on this project, and how we plan to disseminate the results. So the background is that ODEP is always interested in identifying strategies that employers can use to hire people with disabilities. In 2008, ODEP sponsored a survey to explore employer hiring efforts and concerns. So in 2018, 10 years after the first survey, we want to repeat some of the questions in the survey so that it can provide updated information on key hiring and recruitment metrics. We also wanted to explore new topics that were not explored in the 2008 survey. For example, retention and advancement efforts. We know some things about hiring practices already, but what we really don't know is what are the employers doing to retain and advance employees with disabilities. In addition, we also wanted to find out what they're doing to hire veterans with disabilities. We also wanted to, in addition to finding out what it is that they're doing, we wanted to document the employers who are doing good stuff that yielded good results, because we want to be able to disseminate those practices. Ultimately, we want to enhance ODEP's ability to engage employers on how to hire and retain workers with disabilities. So we partnered with Westat to conduct the 2018 survey. Thanks goes to Westat team for helping ODEP with this project. So how did we do it? We used a nationally representative sample of employers with 5 or more employees from Dun & Bradstreet. For firms with multiple branches, headquarters was the sampling unit, stratified by 12 industries and 4 size groups. Data was collected through telephone interviews with human resource managers between July and October 2018. Westat team completed interviews with 2,023 companies. The analysis is weighted to account for sample design and non-response. So today I will share some tabulations by industry and size group. Now let's take a look at what has changed from 2008 to 2018. Some things to keep in mind as you hear these results. 2018 survey was conducted during one of the longest economic expansions in history, whereas the 2008 survey was conducted at the start of the Great Recession. And of course, in 2018, workforce is aging. Who's aging? I don't know what it is, but anyway. And Section 503 goals were also going into effect starting 2015 for federal contractors, and that might also have an impact on these results. And in terms of the focus, we repeated core items on employment of people with disabilities, such as, do you have employees with a disability? But most content changed to reflect current policy interests. In terms of methodology, we added a fourth company size group. Last time, we didn't really have a lot of large employers, but this time we decided to balance it out by having more large employers. And we also included healthcare as a separate industry stratum because healthcare is supposed to be a high-growth industry, and we'd like to see what's going on there in terms of opportunities. Let's take a look at the 2018 survey content. We asked 6 screening questions and 36 questions related to the following topics. Employment and hiring efforts, we asked about, do you have any employees with disabilities? Do you actively recruit? Did you hire someone in the past 12 months? Did you retain, promoted, or advanced? And in terms of employer attitudes, we asked about hiring concerns and hiring benefits. In terms of practices and policies, we asked not just the hiring practices and policies, but also retention and advancement practices and policies. In addition, we threw in a few questions about whether they actively recruit veterans with disabilities, whether they hired a veteran with a disability, and helpful strategies for hiring veterans with disabilities. Let's look at the characteristics of employers in this sample. We looked at industry of goods producing, service providing, and public administration. Company size, small, which includes 5 to 14 employees. Medium companies, 15 to 249 employees. Large employers that have 250 plus. And the distinction between 2008 and 2018, these industry sectors are pretty much the same except for large employers. As I mentioned earlier, we added more large employers. And this is what you really want to know, is the results, right? So let's get to it. The first result is about employment, recruitment, and hiring of people with disabilities in 2018 compared to 2008. 22.7% of employers reported of having employees with disabilities in 2018 compared to 19.1% in 2008. 18.5% of employers said they actively recruit applicants with disabilities in 2018 compared to 13.6% in 2008. 13.5% of employers reported that they hired a person with a disability in the past 12 months compared to 8.7% who reported that in 2008. And these differences are statistically significant, and so it's showing a positive trend. Now let's look at what did they mention as hiring concerns. I will read out the top concerns expressed by 50% or more of the employers surveyed. I will also read out the bottom 2. 87% of employers had 1 or more concerns. The top concern expressed by 59% was the safety on the job for persons with disabilities and their co-workers. The second most expressed concern was the ability of workers with disabilities to perform required job duties. 55% expressed this concern. 52% expressed concerns regarding absenteeism. Attitudes of top-level management and attitudes of supervisors were at the bottom of their concerns at 14% and 17% respectively. Then let's look at hiring benefits. So those were the concerns, but what did the employers perceive as benefits of hiring people with disabilities? Again, 87% saw one or more benefits of hiring a person with a disability. 72% employers reported that hiring a person with a disability projects a positive image with customers. Another 72% reported that hiring a person with a disability projected a positive image with prospective employees. 61% reported that disability hiring increased the pool of qualified candidates. That's really good. At the bottom of the list, 18% saw hiring a person with a disability as a reason of increased productivity. Looking at hiring practices and policies, unsurprisingly, 92% reported as having interview locations that are accessible. 80% of employers reported of providing an opportunity for all job interview candidates to request an accommodation for the interview. Only 4% have a dedicated recruiter specialized in the hiring of people with disabilities. And we hope we can change this by working with employers. Next, let's look at retention and advancement policies and practices. 83% of employers reported an opportunity for employees to voluntarily and confidentially self-disclose that they have a disability. 73% reported that they have stay-at-work, return-to-work programs and policies. Stay-at-work, return-to-work programs, this is a question that we asked in this survey because ODEP is engaged in a number of initiatives in this area right now. So that was of special interest to us. 69% reported having workplace flexibility programs such as flexible scheduling and teleworking. 65% reported ways for employees to keep their existing position but reallocate specific tasks in the event that they cannot return to the same job. 60% of employers reported that they have job reassignments for existing employees who develop a disability. Yet, interestingly, only 52% of employers reported of having disability awareness or sensitivity training. 5% of employers reported of having a disability-focused employee resource group or an affinity group. My bet is probably those are the large employers who tend to have those. Hiring and recruitment of veterans with disabilities. Here's a little teaser. We asked a few more questions. 14.6% of employers from this nationally representative sample reported of making special efforts to recruit veterans with disabilities. And 6.9 out of reported of having hired a veteran with a disability in the past 12 months. So that was not so great. And of course, we are planning to do, sorry, I didn't have the slide on while I was talking about the veterans with disabilities, and here it is. The additional analysis we are planning to do, we plan to do some tabulations by industry and company size. We have a way of looking at how the federal contractor employers did compared to the other employers, and we hope to have a report on that. And we will do some multivariate regression analysis of hiring and retention practices and policies as predictors. We will also have some qualitative analysis based on a small number of in-depth interviews with a subset of these employers that we already surveyed. And the final report will be available in September of this year. And hopefully once we have this, we did this in collaboration with our Chief Evaluation Office. They should be releasing the report, and that should be available on the website sometime in October. I hope you look for it. And that is it. If you have any questions, send me an email. And I didn't put my phone number, not on purpose. I just forgot. Thank you.
So we have about 20 minutes for questions.
Hi, I'm Andrew Morris from ACL, Administration for Community Living, and I had a question for Ms. Taylor, or Ms. Taylor. Thank you for your reaction. Yes, I think that's when you mentioned doing the ACS in prisons and nursing homes, and does that include group homes in the community?
There are what are called non-correctional adult facilities and non-correctional child facilities. When you get into like the group quarters classifications, you're probably not going to find a specific section like that targeted. A portion of group quarters does focus on homes for people with disabilities, as well as rehab facilities, psychiatric and wards, that sort of a thing. Used to bring an entire list of like group quarters, because especially for the disability community, I think that they're important to be able to look at. And a lot of people, when I say group quarters, most people don't know what I'm talking about. So there are, what you're describing would probably be in what just gets classified as non-correctional group homes for adults, most likely, or specifically homes for people with disabilities, but I think you're looking for that non-correctional group home.
I would like ICFs, so group homes for people, for
If you want,
community-based.
Yeah, if you want, I can send
in the
you the,
community.
I can get your contact information, and I can send you the just definition of the different group quarters, what they are, what they represent.
And where can we get that data? Do you guys do?
Group quarters, there are on AFF, there are some group quarters tables, specifically they start with the letter S. S means for subject, so it's kind of the subject matters are allowed to go in and make specific tables outside of the form dictated, which are the tables that tend to begin with the letter B or the letter C. I think it's S, I took a picture of it on that slide. S2601 A through C are specific AFF tables that are related to group quarters that break down people with and without a disability, and they get into institutional and non-institutional group quarters. Colleges and university dormitories tend to be separate. You can't find detailed group quarters on the public use file, but you can find group quarter information on the public use file as well, and disabilities asked for everybody, not just the CNI population, though that's what most of our data is published for.
Hi, my name is Jonathan Lang. I'm from the Special Olympics. I have a question for Mrs. Swick, or Ms. Swick, related to the survey with people, employees and employer hiring practices with disabilities. Does that break down further with type of disability, or is it just general yes, no disability?
Let me just take a quick look before I answer. I don't think we ask about, because this is a survey of human resource managers about hiring practices, and it's very unlikely they would know disability type. It's actually, I'm surprised that they would even know the number of employees with disabilities, depending on, self-disclosure levels. Yeah, we definitely didn't have that information.
Yes, Daniel Davis from ACL. I guess this question will be directed towards towards the speakers from CDC. And one of the things that I've been looking at is access to care and like barriers to care for people with disabilities. And I know that I've seen some of the disparities work, but I was wondering if you could speak a little bit more on anything you're looking at related to access to care or barriers to care.
Okay, I'll take it from the National Center on Birth Defects and Developmental Disabilities at CDC. We utilize mainly behavioral risk factor surveillance system data in our work, and we do have access to 4 core questions in that survey on whether or not someone has health insurance, a routine medical care provider, a cost barrier to care in the last 12 months, and whether or not they've had a routine physical in the past, and various timeframes are given. The behavioral risk factor surveillance system also has an optional healthcare access module that goes into more detail where you can look at continuity of healthcare access over the past 12 months, as well as barriers to prescription medications, as financial debt due to medical needs. And it also contains all of the 6 functional disability types recommended for use in federal health surveys. And then you can also look at federal poverty level with those data. There is a significant number of missing, so you could look at it by state Medicaid status. Several people have done work on that, and looking at differences over time with case control methods.
So it's a question for Savi Swick. I'm Leslie Kaplan from Nidler ACL. So you talk mainly about your preliminary results about employer practices and policies, but you're also collecting data on actual, presumably, this is why I'm asking, hiring, retention, and advancement. And I'm just wondering what kinds of questions or data you're collecting or you have collected to assess those outcomes.
That's a good question, Leslie. Fortunately, I brought the survey with me to be able to answer that. Let me take a quick look here. Give me just a second. It's a long survey. Here we go. Retention and advancement. For example, here's one question we asked. Under the Americans with Disabilities Act, an individual with a disability is defined as a person who, 1, has a physical or mental impairment that substantially limits one or more major life activities, has a record of such an impairment, or is regarded as having such an impairment. To your knowledge, do any of your company's current employees have a physical or mental disability, would you say? So we do ask about that level for this gentleman's question. And then to the best of your knowledge, about what percentage of your workforce has a disability? Let me see what exactly. I will retract. Have any of your employees with disabilities been with the company for 2 years or longer? is one question. Has any of your company promoted any employees with disabilities in the past 3 years, would you say? Yes, I'm not sure, and so on. Does your company actively recruit? So that goes into recruitment. We want to know how your company is proactive in recruiting job applicants. So those are the couple of ones that I just mentioned in terms of retention
that's
and
helpful.
advancement,
Thanks.
some direct questions.
Hi, my name is Mary Otiato from the Massachusetts Commission for the Blind. Go Patriots. Sorry, had to plug that in. I just have a question for Savi. And my question is, when you ask the employers about hiring individuals with disabilities, is there any mention or anything to do with the employers interacting with vocational rehabilitation agencies in their states or in their circles?
I didn't catch the last part of the question. Would you mind repeating?
Yeah. Is there any mention of the employers interacting with voc rehab programs to access individuals who want to go to work?
Let me see. Yes. Contact the state voc rehab agency is a question we've asked.
Thank you.
Yeah.
A simple question about the NHIS release dates for 2017 and 2018. What are the expected releases for the public use files?
HIS are always released right around the May to June period for the prior year,
So 2017 is out and 2018 will be coming out
June
in
2019. Yep.
Great, thank you.
Questions from Andrew?
Worse, she meant, not me. My question's for Julie. I'm thinking about, incorporating HIS into our annual report and looking at year-to-year changes and when the new instrument is used in multiple years. The one issue I'll face is the yes-no makes it a little bit easier to kind of define a group definitively. Have you guys, and in the international world, is there a general practice for reporting statistics and using a certain threshold of, like, in terms of the scale that's used for responses, like only people who reported, severe, or I forget the exact terms. Is there a standard kind of norm?
Yes. So the response options for the new questions there are 4 options. The idea really here is that disability is a continuum and not a dichotomy. And so when you ask somebody how much difficulty you can have no difficulty, some difficulty, a lot of difficulty, or unable. And the recommended is very similar to the ACS. So in the ACS, if any yes, you code it as disability. And with the new questions, if there's any a lot or unable, it is a yes, the person has difficulty. And that applies to both domestic and international research efforts. There have been a number of papers and products that kind of compare what the changes are. And when it comes down to it, what really happens is the people who say yes in any domain of functioning for the ACS split between, some difficulty and a lot of difficulty when you give them a continuum. So.
I'll ask another. There's a question online.
Yes. This is for Savi, a follow-up to the VR question. do they ask the employers if they contact Ticket to Work employment networks to get leads on hiring people with disabilities?
I don't think we have a question about whether they contact the Ticket to Work for that. That's a very specific question. There were a lot, we started out with like 70 different questions. Everyone wanted to ask all kinds of questions, and we had to pare it down to these 36 because as it is, it was a long survey, unfortunately. So.
Savi, when can we expect the public use microdata file?
Probably sometime in October.
October?
Yeah.
Okay, sounds good.
By the way, I should mention that we consulted technical work group experts in the field, and Andrew was part of the group that contributed to developing these questions. Thank you.
Yes, and also the Kessler Foundation survey that John and Elaine went about used a different approach, but tried to get at some of the similar questions. So it'll be interesting to see some of the things. One of the neatest variables in your survey that would be the most comparable to the 2008, which I was involved in, is that actively recruiting. And it was interesting to see that variable increased. And it'll be interesting to see that breakdown by size and industry, and see which industry, if there were any industries that were better at picking up that actively recruiting people with disabilities. Because as we talked about, it's kind of the life space question. Did they actually do this thing? Yeah. It will be interesting to see that particular variable was very powerful in the prior 2008 survey.
Absolutely, and we really want to see that by the federal contractor as well, which is a specific question we asked this time around to see.
Yeah, federal contractors would be interesting. Yeah. Do we have another question? How much time do we have left?
We can wrap up and have John O'Neill come up.
I have one more question.
Oh, okay.
For Danielle, just because I knew you didn't.
You're trolling me.
Yeah, I am. It's trolling. Do you know if there's any efforts or discussions at SSA to support another supplement to the SIPP?
I have a prepared statement if anybody asks me about the SSA. We know how to be invasive.
I am not able to
the
speak
federal
for the
statistical
Social
system.
If you can't answer, that's fine. It'd be interesting to find out if they're planning to redo it, because it's a powerful module.
The SSA is interested in adding disability content to SIPP core.
Core, yeah.
But nothing is finalized.
Right. Okay. Sounds good.
Well said. Tells me how to prepare a statement.